Welcome to the STARS program, seniors taking active roles in society. And now, here's your host, ANITA FINLEY.
So now we have one of our finest physicians in a very specialty. It's an otolaryngologist. You probably don't know it. Sina Joorabchi is just that. And maybe you hear it as an ear, nose, throat specialist, but Sina loves things that are different. So thanks for coming on our show, Sina. And what are we going to talk about that people don't know about today?
There's something going around the community. I don't know if you've heard of it. It's got the same name as a popular beer people like to drink. I don't know if you've heard of that thing, the little virus. So it's,
yeah, right, the coronavirus, right.
Right.
Corona beer, right?
Yeah, right. No,
tell me what's going on with you. See, you're a specialist, and tell us that when people get this, it affects things that you know about.
Well, yeah, we've myself and Dr. Shapiro, our offices have remained open because there's still people that have needs to be serviced, and part of our civic duty is to also help out our local ERs to make sure that they're not well burdened by things we can handle, such as nosebleeds or dizziness. Or sinus infections, but there's a lot of overlap between us and the coronavirus because right now is allergy season, and of all the patients I see, not one patient passes by without asking me if they have corona or not, and so it becomes a real thing. It's all in our mind. We've all probably woken up in the morning and like, I don't feel like this is happening now, and so what myself and Dr. Shapiro have kind of made a point to do is to get educated. I mean, we're reading everything each day, not only headlines, but really the well-informed, physicians and studies and the CDC guidelines, and basically discuss it with our patients to kind of, one, keep them out of the ER unnecessarily, and two, relax any anxiety they have. Because, it wasn't something I originally intended on doing, but it was just something that fell in my lap. I have to do it. I have to stay knowledgeable, and I have to be up to date currently day to day. So we've been doing a lot of telehealth phone calls and like virtual FaceTime with our patients and kind of running through their risks, their exposures, and their symptoms. They're either saying, hey, you're okay, or no, maybe you should do this, or no, you really should get tested. And it's been, honestly, it's been awesome. I mean, it feels like I'm actually helping out. I was helping out before, but this is to another magnitude where this is a call to action for what's going on in the whole world, and we're contributing our way because we know how to handle allergies, and now we know how to separate pretty well between that and COVID. So that's kind of been a hot thing for us. It's kind of working.
But Dr. Joorabchi, let me ask you: any of your patients have the coronavirus?
So, unfortunately, yeah, we've had some patients that have had it, and unfortunately, we've known some patients that have passed with it.
Really?
And it's kind of surreal. I mean, it's kind of crazy. I say it every day. It's just such a crazy thing going on. But this is a reality, and we have to, dig our heels in the sand and keep fighting and do what I can do to bring value to my patients and just people around me. But yeah, we've had it. Nobody's been in our office that has it. We're very diligent in our office. We're not letting anyone come in without masks. We've been doing that for the last, couple of days, even before they announced it. Anyone that has a cough, we're not bringing in. We're doing telehealth. Anyone that has any sort of symptoms, we're keeping a low threshold because we don't want to mix the patients that potentially have COVID with the patients that really need us, that we can kind of levy the burden from the ER. So again, your nosebleeds, your vertigo patients, we don't want to complicate their lives with a COVID exposure. So we're trying to keep all the COVID in telehealth form. And if anyone has any hint of those symptoms, to basically either keep them at home or discuss strategies or to refer them to local testing centers.
So you're not testing them. That's what's very important. We say that so they can't call you for that.
No, we're not testing.
Okay.
You know, we've thought
I see.
about it, and I think, you know, if there is a point where it makes sense, you know, maybe consider, you know, doing that. But at this point, we're definitely not. We're just screening patients um, via telephone and FaceTime, and which is pretty simple to do. And I think the feedback has been really positive. Patients are really appreciative of us saying, you know, you really don't have it. And the truth is, of the 100 that I've done, maybe 5 have been referred for testing. So it's not that common, at least at this point. And when I say testing, it's a little bit different because, I mean, you can have it, but we may not be referring you for testing because your risk factors aren't there to drive us to get you tested. In a perfect world, we can test everybody, but this is not a perfect world right now, so we have to be very careful on our resources.
Yes, that's very good. And you have young children, so how are you handling that? Your wife and the children are there.
So on one hand, like, yeah, I mean, the kids are home, and so the first thing I think about is, listen, I'm serving the community. How do I not bring this home? So fortunately, the kids are showing to be pretty asymptomatic. They're not really getting hit hard with this, thankfully. I mean, to the point where they're not requiring kids under the age of 2 to wear masks. And you know, so when I make sure to wash my hands before I leave the office, my steering wheel, everything is clean in the car. I clean each time. Then before I get home, I invert my scrubs and put it in a basket and go right into the shower and just kind of douse off. But this is my advice for everybody. And I've seen my wife do it. I've seen, you know, my kids do it. You have to think of your home as no different than a grocery store. There's going to be someone that slips up, either with carry-out food, a package, a mail, touching it too soon and getting exposed. And you have to protect your eyes, your nose, your mouth. You cannot be rubbing these areas or exposing yourself to these areas. You have to be washing your hands. So you are not safe at home. That should be the attitude at this point. You should not be comfortable, let your guard down, rub your eyes when you're home. No, in fact, it should just be everywhere, uniformly, because people, it's coming in ways that you're not expecting. It's maintaining on metal surfaces longer than you appreciate. And, you know, we're imperfect. You know, it's going to slip through. And the only way you can protect yourself is not let that droplet get into your eye, to your nose, or your mouth. If you can protect those areas and don't let that corona droplet get there, you're going to be good. But
I'm so glad we got you on the show today. I want to tell everybody you're listening to Dr. Sina Joorabchi, who is he's an otolaryngologist, and he's there with Cntr.org, which is South Florida ENT Associates. They're located in Pembroke Pines, and I'm due to have my ears cleaned out, but I'm not going there yet. We're going to wait. I don't need, and telemedicine isn't going to help me. You can't go through your phone into my ears.
Yeah, so the government's really stepped up in that way too, because before, telemedicine wasn't really feasible. There's just so many hurdles, and at that point the patient was like, okay, you know what, this is silly. I'm just going to go in and see the guy. But now it's, you know, there's no copays, there's no pre-authorization, so it's literally someone from New York can call me, and as long as they're my insurance, you know, which most cross state boundaries, it's fine. Or if they're in Boca, if they're in West Palm Beach, which people have been doing, because I do have a pretty significant social media following. So once I made it known, it's kind of like I'm reaching out to the people that have been following me, which has kind of been unique. You know, people have said they follow me on social media, and here I am talking to them as their doctor when I never thought I would be doing such a thing. And again, like I said, it feels great. It's like you're helping out the community, you're making the majority of people feel at ease. And I think it's important for anxiety to be less. When you're less anxious, you're less stressed. When you're less stressed, you are less likely to get sick.
Yes, that's a good point. And that's why we were so happy that you were available for us to do this with you today, because you are you're the source. When you tell us this, it means an awful lot. I mean, we hear a lot of researchers and people, but this has been your profession. I mean, you're in the ear, nose, and throat of so many people, and I appreciate you doing. I do have to ask you a question. I have a relative in North Carolina who had sleep apnea, and he's been tested. He's gone through everything, and apparently he has the worst. I don't know, there were different levels, but he has the one that's the most serious. So he's been trying to use his apparatus, but he's not very happy with it. He's trying to give it up, and I've told him, you ought to go to a support group. Find other people who use it, and maybe they can encourage you. What could you say to him to tell me and I could say to him?
So that's a great question, a great topic. The bottom line is do something. Don't sweep sleep apnea under the rug, because it's no different than high blood pressure or high cholesterol or diabetes, because it can cause, heart attacks, strokes, car accidents. There's real life-risking adverse events from not treating your sleep apnea. I mean, if you think about it, when you don't sleep, you don't heal. That's why people are saying, for corona, you need to sleep. That's how your immune system is going to stay strong. So for him, we want to try to get him on the mask. That's the main goal. And usually people have trouble. People have trouble because they can't tolerate the mask. Their nose is congested. Their septum is deviated. So imagine sticking your head out of a moving car at 10 miles an hour versus 40 miles an hour, right?
Oh, my.
So if you're a 40-mile-an-hour guy and you're saying, okay, go to sleep, there's no way you can tolerate it. But if we can open up the nose, it usually requires a lot less of a pressure. So you could be like a guy sticking his head out of a moving car at 10 miles an hour and have a better chance of success. So I get this consult a lot. I get this patient a lot. And my strategy is to work on the nose. And I'd say I'm probably 60% successful at that point. But then there's just people that just they'll use it. They just don't want to deal with the hassle of carrying it around. Or if they're dating and they don't want to deal with, they have some concern about having it, around and wherever. And so there is another alternative. It's like a pacemaker-like device for the tongue to help keep the tongue forward. And it's about 80% successful. This device is called Inspire. It's 80% successful in ridding you of sleep apnea. And you don't have to wear a mask. You basically just kind of set on the device at night. And when you fall asleep, it prevents the tongue from falling in the back of the throat. It sends a little pulse to the tongue to keep it forward. So it's 80% successful, but 95% of people are satisfied with it. They love it. The hurdle is you got to go through surgery. You got to get this thing implanted. And the mask, when you wear it, 100%.
Where? Into your throat? Where are you getting it inserted?
So you put this pacemaker-like device on the chest wall. It's about the size of like a gum packet. It's like a 4 centimeter wide by 4 centimeter wide thing. And you basically, maybe even smaller. I think it's actually 2 by 4. They made it smaller. And you track a wire under the skin that goes to the nerve to the tongue. So you have to make an incision on the chest wall, an incision under on the neck, and then one more little incision on the side of the chest. And these are incisions that are relatively concealed. People can't see them that easily. And then we basically hook up the device to the nerve, and we activate it in the OR. So think of Gene Simmons from Kiss. When he's sticking his tongue out and gyrating the tongue. That's kind of like what we see in the OR. And then once we know it's in good position, then we kind of sew everything up. And then about a month, we activate it, and they're off and running. That's it. You replace the electrode every 10 years, and it's done in the office. It's very easy to do. And that's basically, another alternative. The truth is those are kind of things that address the majority of people, either fixing the nose or this Inspire device. But there are other options or other surgeries. It all depends on where the blockage is. that's a long answer to your.
Well, that's good. But I knew you had once talked about this, and I wanted to get that on because I will now take the tape that we make of this so he can hear it. So, but it's a strange question, but do more women get this or men, or is it equal? Is it a particular sex?
For sleep apnea, it's more common in men. It's because they tend to hold more tissue redundancy in the back of their throat and in their tongue. Men are more likely to be snorers. Men are more likely to have more mass in the neck. So the larger the circumference in your neck, the more weight is on the airways. And so if there's less weight, then it's less chance of it collapsing. So that is.
And how do they know they have it? If someone snores, is that how they know?
Well, that's what makes you start asking questions. Snoring doesn't mean you have it. It makes us raise an eyebrow. So if you're a snorer, but either a spouse or a significant other said, we've noticed you do funny things while you're sleeping or stop breathing, and you also feel like you're not well rested, those are kind of the three concerning facts that make us want to look into it. And it's a pretty easy test now. You basically take this little box home with you and you hook it up to yourself, like into your nose, into your chest wall. That's like a little like nasal cannula and little electrode on the chest, and you go to sleep. And you turn it off in the morning, and you send it into the insurance carrier, and they basically will send me the data on your sleep. We basically check the quality of your sleep in your home. It's called a home sleep study. And off that, then we make the determination if you officially have sleep apnea or not. I'm a surgeon, so I can look at tissues, look at the nose. If I look at the nose and look at someone that has huge tonsils and a huge tongue, I kind of know off the bat with these relationships that they're high risk. And there's been many times where I've pushed patients to it. I'll joke and say, I'll bet you a 6-pack of beer that you have it. And they're like, I don't have it. And they come back and I choke them for air 50 times in an hour. So, and it's eye-opening because people don't want to be confronted with the truth. But I push them to do that because that's the thing that's going to be keeping you alive longest. If you sleep, you're going to live longer, bottom line. And
so have you had people who actually died because they didn't have one of these and they couldn't get their breath at night and didn't know it?
So I haven't had a patient come to mind. I did know of one in training maybe about 10 years ago that this had happened to. One of my patients had not really known anyone that's passed away. Heart attacks, yes. Strokes, yes. Car accidents, yes. Absolutely. And this is definitely a very real thing. You're at a 4 times risk of getting into a car accident when you have sleep apnea if it's uncontrolled. And
but it's interesting because it's something 25, 35 years ago we didn't hear about this. It wasn't something, but now it seems like so many people have sleep apnea.
Yeah, I mean it's I think it's a combination of we're aging well. We're aging into longer periods, but that also means that the tissues on the outside of your face are no different than the tissues inside your throat. They will continue. Gravity will exert itself on it, and so it means you'll be more vulnerability to have tissue redundancy or excess tissue in the back of the throat. And if that happens, then there's a risk of you basically having sleep apnea because your tissues will close off the airway.
Okay, and the other question, and I know that, of course, I have never smoked, and apparently you don't smoke, but why is it whenever you go to a doctor, the first thing they say is you have to stop smoking, do not smoke, but this is in your area because this is what you see. And there's some horrible things on television now where you see a woman that you can hardly watch her or look at her, and she said that I smoked and they told me not to smoke, and look what's happened.
So smoking is so many different risks that it poses. So just specifically, I can tell you from the sinuses, there's these little hair cells called cilia. These cilia move mucus out of the sinus, move it out of the nose, move it out of the lungs. Smoke paralyzes these cilia, doesn't let them move. So when you retain more mucus in the sinus, it's like standing water in your kitchen sink. If it stays long enough, bacteria is going to grow. So it makes you at a higher risk for having nasal issues, sinus infections. And without that being said, I mean, there's obvious risks, cancer, COPD, issues with your blood vessels. So, and just in general, people can have throat irritation. They have these chronic sore throats, and they feel like it's always like a strep throat or an infection when it's an irritant. Constant irritant in the throat can dry it up and basically create a sore, a wound, so to speak, and just be a source of a chronic sore throat. So those are kind of the common reasons why we'd advocate against smoking. But more specifically from my area, it can affect your ears, your nose, and your throat. So don't smoke. That is for sure.
Yeah, you were very clear about that, and I wanted it said from you because there still are people who smoke, and I know quite a few, and they don't want to anymore, but they just said that they're so addicted they can't stop. So someone comes in like that, what would you recommend that they do if they do want to stop? They can't just do it cold turkey. Can they do it cold turkey?
So I'll be honest, you're kind of asking the plumber about electricity right now. I don't coach my patients through. You like that line? Well, it's true.
Yeah, I love
the
that.
plumber knows a little bit about electricity, but you got to be careful how much you take from him.
Okay.
And I don't want to sound like my colleagues are like, what is this guy talking about?
No, but you're very
is,
smart and you're around it, so I just thought I'd ask you.
Yeah, no, I have some insight. I think it's been very well known that if you want to stop smoking, you have to use two different mechanisms. What it means is either Chantix, like a medicine, paired with a behavioral group, a focus group, or with like Nicorette. It's been shown if you try to do one thing, if you're trying to do a medication alone, it's a lot less successful, or just Nicorette gum, it's a lot less successful, or just a focus group alone. No, it's got to be a dual faceted approach. The biggest thing too is that there has to be a want, there has to be a desire that you want to stop smoking. So that's the first, and after that, it's whatever you do, make sure it's a double combo therapy. Make sure it's two different things, and you're at a greater chance of success.
I think that you said the motivation is really the key. If they really, people who smoke, you ask them, they really love to smoke. That's the one joy they have, and and so it takes something.
You look at like the Rat Pack, James Dean. I mean, all those guys look so cool doing it. I mean, they were just. It's such a cool thing. I mean, how great it would be if you could smoke and not have any of the issues. It just feels cool.
I know.
But the reality is there's a significant downside, and there's been such a shift in today's society as far as longevity, living longer, living healthier, and this is definitely a big part of that, for sure.
So let's go back. We started with the coronavirus, and we have a less than 5 minutes, and I want you to go back to that because do you think, and I don't know, and I know you're not a researcher, but once someone's over it, can they get it again? I mean, they're not sure about that yet, are they?
So we can do like a qualitative analysis. So basically, like what we bet on, not hard fact like studies, but just kind of like trajectories, traits. And the thought is that your body will create an antibody response, and it'll basically be able to fend off any future invaders or the existing invader. Mm-hmm. Now, there is a worry about this virus being having some mutating potential, albeit it is a slow mutating potential. That's what's been found. There is a concern that this might be a seasonal thing, but the hope is that by then we'd have the vaccine to cover it. So the short answer is you shouldn't get it. It's unlikely you'll get a bounce back infection the next week, but there is a possibility it might be something where you get this again down the line. I mean, maybe a year or two if this virus continues to mutate, but hopefully by then we're much more well equipped to handle it. So
Right.
if you get it, God forbid, and you survive, then
Yeah.
you are going to be immunoprotected for a good while.
hmm And the thing that I think is so hard is where, especially in New York, when you see what happened and when people aren't taking the precautions. I mean, well, maybe in New York they are now, but there are many southern states that they're just being oblivious to it, and I think that's going to be hurting all of us. So, of course, we can't get into that part of it, but I certainly hope that everyone does take it serious, as you're talking about it. It's pretty serious, isn't it?
It is. So I was talking to one of my ER friends last night, and he works at one of the Memorial hospitals, and he said he's not as busy as he would be normally, but it's all corona positive patients, not just corona negative. It's all corona positive patients. He's not getting his traditional nosebleeds or stuff that he would see or cardiac issues. It's all corona, so it's here. It is here.
It's here.
I mean, it is officially here on the front lines. Not that it wasn't, but it's pervasive. And like I said before, you have to treat it universally that anywhere you go is a risk. Your home is not safe. Your car is not safe. You have to not touch your eyes, your nose, or your mouth. And like I said, we are here offering like telehealth, FaceTime, phone calls if you have any concerns.
And I'm going to do that. Let me thank you. It's Dr. Sina Joorabchi, and let me give you, you can call them at 954-438-7171, or you can go to their website, which is spenta.org, Spenta, which stands for South Florida. That's SFENTA, right? SFENTA,
yep.
Spenta.org, South Florida ENT Associates. They're located in Pembroke Pines. And once you meet Dr. Joorabchi and Dr. Shapiro, you'll fall in love. So I'll see you as soon as this is over, please. Thank you so much, Dr. Joorabchi. Be safe. Okay. Bye.
Be safe, everyone.